In 2022, COVID is still in circulation, RSV is on the rise, and the flu is hitting in full force. So with Thanksgiving just 2 days away, I talked to Metro Detroiters and health leaders about how we should approach family gatherings this holiday season. Detroiter Mateen Garrison is traveling just before the holidays. Top of mind, protecting his young family.
I got a 3-year-old, so I don't want to be just out here like without a mask, and I'm not really knowing what's in the air.
Physician assistant Heather Wagner of Express Med Urgent Care in Southfield does know what's in the air.
Flu, RSV, all of these other upper respiratory viruses are really big right now.
And COVID. But it's been a busy RSV season that's been putting a strain on hospitals, filling up pediatric beds, and fueling a surge at doctors' offices and urgent care clinics like Express Med. Wagner says because symptoms are so similar.
Upper respiratory symptoms, runny nose, sore throats, coughing.
This holiday season is still one where caution is key, especially if you're symptomatic. Even if it's just a runny nose for you, it can be much more severe for others around the table.
Consider staying home this year, masking, things of that nature, because we really do want to keep families safe, whether it's from COVID or these other infections that are really rampant.
Another step, read the room. Illnesses like RSV can be especially dangerous for populations like the very young or the very old and the immunocompromised. And they can even affect healthy members of the community.
Even if your immediate network doesn't have a vulnerable community member in it, a secondary person's may.
Back out at Metro Airport, masks are harder to find this Thanksgiving travel season. And that's not sitting well with Shirley Washington, who lowered her mask for this interview. With everything going around, she says she's worried about her daughter's unvaccinated family.
I mean, it's just crazy. It's a crazy time. So how do I feel? I'm very concerned.
Colleen McDowell is not as concerned.
I work in healthcare, so I know what we need to do to keep ourselves safe, so it hasn't really crossed my mind.
McDowell and her family are off to a Hawaiian vacation that was postponed from back in 2020. When asked about where people should draw the line for staying home,
You're at all symptomatic and you're coming down with anything, then I would probably just say, you know what, maybe it's just best if, we don't get together.
Now, there is no one-size-fits-all answer. Wagner suggests, though, erring on the side of caution, especially if you have a fever or other significant symptoms. The CDC recommends masking indoors if you're unvaccinated, have a weakened immune system, or are fully vaccinated but in an area with substantial or high COVID-19 transmission. Now, the viruses that cause the common cold are also in circulation. And because the symptoms of all of these respiratory viruses are so similar, if you are showing symptoms, consider getting tested. That way you can get specific advice based on the illness you're fighting.